I am so excited to get the opportunity to speak with one of our newest physicians at Baxter Health, Dr. Mitsakos. Welcome to Mountain Home.
Thank you very much. It's a pleasure to be here. Thank you for the opportunity to Baxter Health, of course, KTLO. What a beautiful fair. Really, really amazed to be here and really, really humbled and excited to help the community in any way we can. Thank you, Ms. Loftus.
Surgical oncologist, general surgery, one of 3 in the state of Arkansas. Why did you choose Mountain Home and Baxter Health?
Yeah, so it is really rare to find one of us in this state. I know that the general surgeons here already do a fantastic job, but our patients many times need to travel to 3 or 4 hours back and forth in order to get specialty surgical oncology care. So I think one of the reasons for me was that I thought that I would be able to make a real difference in the area, in the community, challenge myself for sure, and why not? Being a very supportive place in a community that we can all make a difference and can make a new program out of scratch and put the skills that I have gathered over my years of training into good use.
I had the opportunity to listen to him speak a couple weeks ago. You took a map on the screen and you made a big circle.
Absolutely
and you
did.
showed of North Central Arkansas and the surrounding area how many patients you will be able to help and treat in this area. You have great ambitions, you have very high expectations for the program you want to build.
Absolutely. The expectations are high, and what I was telling you in that presentation at Baxter is that even if we're able to start with maybe a 20-30% of that would still be a very significant amount of patients. Every patient is a win. Every patient we can help catch earlier, treat more individualized fashion, and be able to keep next to their family, next to their loved ones, is a win for us. So we will start one patient at a time, but I am very confident that we will be talking about probably thousands in the next few years that I expect to be here, and hopefully the cancer program can grow in coordination, of course, with the other multi-specialists here.
What are the most common cancers that are detected in this area?
Yeah, that's a very good question that I have been thinking about myself too, going down the route of trying to get a better feel of the patients and the community here. I think that we are in a medically underserved area where not all of the patients get the screening they need. So I think we see a lot of patients in advanced stages. Now, the most common, as with any place, would probably be breast cancer, which we definitely treat, prostate cancer, that for men is something that the urologists take care of, and of course colon cancer and lung cancer. Right. From these 4 that are usually the most common, breast and colon and rectum is definitely part of my specialty, but also we will also take care of other common and not so common cancers that can happen both in the abdomen and in the soft tissues, in the skin, in the thyroid, in the liver, in the pancreas. There's a multitude of bad things that can happen, and we're here to take care of it.
I realize this is a very complex question, but how do you know when surgery is an option, or if you're speaking radiation, all the different treatments, how do you know when surgery is your best option?
I wish I could answer you with one sentence: years of training and years of other people's experience that we are trying to step on their shoulders in order to take care of patients, right? And we have to fill some very big shoes regarding cancer care that has expanded immensely in the last maybe 10, 15 years. That's where the multidisciplinary aspect of our care comes.
Yeah. You have a great partnership with Baxter Health, Highlands Oncology.
Absolutely.
You're kind of the focal point in bringing all the different people to the table to help our patients.
Yeah, and that gets back to the prior question and to our main goal here, which is because cancer care has become so individualized in our times, we might see multiple patients with the same quote-unquote type of cancer, and everyone gets a different treatment approach. And someone would think, why? My neighbor had that and got this treatment and went great, and I get that, and why do they say it's a different treatment? So we're trying to focus on individualized care because we have such a large armamentarium and such big opportunities in doing both surgical care, systemic care from medical oncology, and radiation oncology care. And that's why we coordinate and we do tumor board with our Highlands Oncology colleagues.
I'd be remiss if I didn't ask you. It's Breast Cancer Awareness Month. It started today. I see your pen. What advice do you have for our patients that are going through breast cancer treatment right now?
Absolutely. If we could keep one thing, Breast Cancer Awareness Month, most common cancer in the female population, right? Super important. We know the numbers. 1 out of 8 women. Here, if we see all of the ladies that are here with us in the fair, 1 out of 8 in their lifetime have, or will have breast cancer. So super important to be aware, super important to coordinate with screenings. So we have the mammogram outside. Baxter has been fantastic in bringing the mammogram. MMU, yep. Fantastic. Now I'm learning, I'm new here. But that's exactly what we want. Awareness, people to know that there is screening opportunities, and that's very, very important for early detection and easier treatment approaches rather than finding something much further down the road and having a much more complex care.
Well, sir, we are so thrilled
Absolutely.
to have you in this area, to have you a part of Baxter Health. Now, you're going to head over to the Physicians Lounge, take questions, meet different people.
Yes.
There to answer questions and all that good stuff. So, sir, thank you for your time.
Thank you very much for having me. It's really a pleasure and an honor.
Dr. Mitsakos, the newest physician at Baxter Health with the surgical oncology.